Welcome to CostViz, the channel where I investigate the cost of everything and how the numbers are put together and presented. Today I look at the costs and benefits of participating in Dry January, a month-long challenge where individuals abstain from alcohol to reset their drinking habits and improve health. If you're taking part, well done, and this is a check-in, almost a motivator to remind you why you're doing it. If you've fallen off the wagon, don't worry, just get back on. My goal is to evaluate the cost implications associated with Dry January. Dry January is a month-long challenge where individuals abstain from alcohol to reset their drinking habits and improve health. It was initiated by Alcohol Change UK in 2013, and it encourages people to take a break from alcohol for 31 days, offering benefits like better sleep, increased energy, and improved mental clarity. Engaging in Dry January also provides an opportunity to reassess one's relationship with alcohol, potentially leading to healthier long-term drinking habits, physical, mental, and financial clarity. According to Alcohol Change UK in 2013, approximately 4,000 people participated, and by 2022, that was over 130,000 individuals signed up through Alcohol Change UK alone. In the US, in 2022, around 19% of Americans plan to forego alcohol in January, with 77% of previous participants intending to join the challenge again. The movement has also gained international traction, with millions participating across Europe and other regions. Throughout the episode, I'll show key costs and indicators to assess the impact of Dry January, and I'll aim to provide an understanding of the tangible and intangible benefits of participating in Dry January. So don't forget to subscribe to the channel, hit that like button, and share it where you can. Let's look at the cost implications. According to the Institute of Alcohol Studies, the breakdown of the average on-trade, which is the price that stores or businesses pay for goods rather than the price at which they sell these goods to the public, the on-trade price of a pint of beer is £3.64. When you break this down, 12% of the retail price is excise duty, so this is on the price you pay. VAT is around 17%, and depending on specific logistics and suppliers, the remainder of the price is production and distribution, which includes brewing, packaging, and transportation. The price you pay will then have the retailer or producer markup for their margin, and that varies significantly. For a glass of wine, in this case it's 175 milliliters and 12% alcohol, the average trade price is £4. You can see how that breaks down, but the margins vary and are factored into this price. Production and distribution costs also vary, but these include viticulture, fermentation, aging, bottling, and transportation, so they're different to beer. Then we talk about spirits. In this case, it's 700 milliliters and it's 40% alcohol. In this case, the duty is quite high for a 700 ml bottle at 40% alcohol. VAT is also fairly high, but it's still at 17%. And the production and distribution costs include raw materials, as well as all the distillation through to logistics. So when we look at the price, there is a substantial amount attributed to excise duty and VAT. The remaining costs vary significantly to cover the entire process, from raw materials to the point of sale, and the profit margin, which is dependent on the producer, distributor, and retailer agreements. So who is doing the drinking? And what do the demographics say about consumption patterns and the cost implications of Dry January? I've gathered these stats from different sources, but it's specifically relevant to the UK. In 2017, the amount that an average household spent on food and drink, including alcoholic drinks and food eaten out, was around £45.31 per person per week. When inflation is taken into account, the amount spent was 0.3% more than 2016 and 3.8% more than 2014. According to Alcohol Change UK, there is a decrease in consumption amongst younger adults. Consumption of alcohol among young adults has been declining steadily since the mid-2000s. Today, the average consumption per adult is around 18 units a week. There's also been a notable shift in alcohol purchasing from pubs, bars, and restaurants to supermarkets and off-licenses. In 2015, for the first time, supermarkets and other off-trade beer sales overtook pub and on-trade sales, with 51% of beer sold through the off-trade. Economic challenges, such as the cost of living crisis, may have influenced consumer behaviour, leading to increased alcohol purchases from supermarkets due to lower prices compared to pubs. The COVID-19 pandemic accelerated the trend towards home consumption, with restrictions leading to a rise in supermarket alcohol sales. But we won't truly know this impact for a few years still. According to Nimble Fins, there is a correlation between a higher income household and the spend on alcohol. Spending on alcohol rises significantly with income levels. Households with the highest 10% of income spend over 4 times as much on alcohol as those with the lowest 10%. Alcohol consumption in the UK is an evolving picture, and there is a clear shift towards home drinking and varying expenditure patterns across different age groups and income levels. The binge drinking culture that was prevalent in the early 2000s is on its way out. I wanted to calculate the total alcohol expenditure in the UK for January, so I had the following set of assumptions. That the average weekly alcohol expenditure was around £15.30, and that combines pubs and bars and supermarkets and off-licenses. And the number of households in the UK, according to the ONS, is around 28 million. We assume that the alcohol consumption in January remains consistent with the annual average. So the number in fact that's presented here of approximately 1.7 billion does not account for dry January, and the data variability could be quite significant, and it could be due to regional differences, income levels and changing consumption trends. So let's consider the sellers and retailers, and then let's consider the government and the NHS. So do restaurants and publicans miss out? Dry January presents both challenges and opportunities for publicans and restaurateurs. In January 2024, bars and restaurants experienced a 9% decrease in cocktail sales revenue compared to the previous year, indicating a shift in consumer preferences during dry January. Bar chains reported a 13.6% drop in sales in January 2024, which also highlights a direct impact of reduced alcohol consumption on their revenue. But is it all bad news? To mitigate the impact of dry January, many establishments have expanded their menus to include a variety of non-alcoholic beverages such as mocktails and alcohol-free beers, catering to the changing preferences of their clientele. And in the same period, pubs and restaurants saw a 4% rise in revenue from non-alcoholic beverages, reflecting a growing consumer interest in alcohol-free options. So what about tax revenue lost during dry January? Taking the total alcoholic duty revenue considered from the Office for Budget Responsibility, the OBR, and then the monthly revenue estimate, and breaking that down into just even months, and then considering that dry January had a significant number of participants, 15% of the UK population, we then estimate the tax revenue lost as 15% of around £1 billion. So over £150 million of lost tax revenue this month alone from dry January. But this doesn't consider seasonal variations in alcohol consumption, such as a natural decrease in January post-holidays, substitution effects. Some individuals might switch to non-alcohol alternatives, which could still incur VAT, partially offsetting this loss, and significant data limitations. So there's no precise data on actual reductions in consumption, and spending during dry January is limited, making producing estimates of this challenging. I then wanted to see what would be the calculated cost saving to the NHS. So reducing alcohol consumption could lead to significant short-term and long-term benefits for the NHS. I wanted to have a look at what the current economic burden of alcohol was on the NHS, and it looks around almost 5 billion each year for alcohol-related harm costs. There could be short-term benefits of dry January related to a reduction in the need for hospital admissions due to alcohol-related incidents such as accidents and acute intoxication. So taking that key data, we do the following calculation, but the key assumptions here is that there is a decrease in alcohol consumption during January that leads to a proportional reduction in alcohol-related healthcare costs for the month, a uniform distribution of those costs throughout the year, and that the health benefits and subsequent cost savings are directly proportional to the number of participants in Dry January, which obviously won't be the case. But if you take these calculations, it looks like an estimated saving of £61.7-ish million. But there are data limitations here. Actual savings may vary based on several different factors, including the accuracy of participation rates and individual healthcare outcomes. Embarking on Dry January can be both rewarding and challenging, and to support you in your journey, there are loads of tools that can help you in your journey in Dry January. You can try the Try Dry app, which helps you track your drinking habits, set goals and monitor progress throughout the month. Alcohol Change UK have loads of resources online. You can call the Drink Line hotline, which is a confidential helpline, and it provides advice and support for you concerned about your alcohol consumption. Online support communities are big these days as well, so you can go to Meetup and go to those platforms to look at Dry January support group. Of course, if you feel comfortable, share your Dry January experiences below, the challenges and your insights on the costs that can inspire and support others on their journey. If you find this episode useful, please give it a thumbs up and subscribe to my channel for more content on cost, as well as helpful hints and tips for estimators. Don't forget to hit the notification bell to stay up to date on our latest episodes. Remember, taking a break from alcohol is a personal choice, and seeking support is a sign of strength. And I wish you a successful Dry January.